We are back here on Girl Talk. We are taking a field trip today. We are here at Beaufort Memorial Hospital. Dr. Kurt Gambla, thank you so much for joining us. You're our Chief Medical Officer. And Miss Lisa, nice to see you too. Lisa Taylor. You are with telehealth.
Yes,
correct? And it's really interesting. We were talking before we started the show a little bit about what that actually means for Beaufort Memorial.
So that means using technology to connect patients with providers, whether that be for primary care or specialists.
And what's interesting about that is when I came in today, the first thing I showed you was Beaufort Memorial Health Care Anywhere. It's an app that I have on my phone, and we're here today to talk a little bit about that. Talk to me a little bit about why, how it works, what it is.
Okay, so this is another tool that we use to create access. We're always trying to figure out how to allow our patients to get into the system quicker, easier, more convenient where it's appropriate. So this is a tool where you can go on. It's very similar to Skype or FaceTime, where you can talk to a physician for certain kinds of sort of low acuity, low risk conditions, and have a sort of a virtual visit.
It's interesting to me because it's very client-patient centered. I would love to know if you guys, if you all don't mind, walk me through what the procedure is. I've actually used it 3 or 4 different times, and I'll tell you with aging parents, let me just interject that right, it's been amazing because it's difficult to get moms and dads to the doctors, but this has been a real godsend. So how exactly would it work?
So once a patient logs in, they can expect a visit to take anywhere between 5 and 10 minutes. They'll spend the first couple of minutes just entering very basic health information, specifically the reason for their visit today, and then the doctor spends a couple minutes reviewing that information. After that, they connect and the doctor's able to diagnose and prescribe any medications that they might need.
She makes it sound really streamlined, and it is. Actually, practically going through it, you literally can log in with your fingerprint. Talk to us a little bit more about that. And then the doctor selections, because you can find a doctor in real time.
That's right. So once you log in and you're in the system, it'll give you a list of doctors, waiting times, and the way that we have it set up is if you're local, you're going to see our doctors first. But since all our doctors aren't on there all the time, 24/7, 365, we have sort of a backup crew that's part of the online caregiver group. So there will always be a doctor, but you can preferentially use one of the docs that we have that's a Beaufort Memorial Hospital doctor. And then it's just a matter of when your visit time comes up, you have the visit. And as Lisa mentioned, the part of that visit, if it results in a prescription, the doc already knows where the nearest pharmacy is or the one you want to use. Prescription goes right there, it's waiting for you when you get there.
What information would help a patient? How do they get the app? What is sort of the logistics of all of this?
So if they're planning to use their phone or tablet, they can go to the App Store or Google Play and download the app there. If they prefer to use their computer with a webcam, they can visit bmhcareanywhere.org.
You gave me a little present today, which I love. You've got these, yes, pop sockets, which are great to remind you to. But I think I can't emphasize enough the patient-centeredness of this Beaufort Memorial Healthcare Anywhere. What are some of the reasons I might access this rather than go to an urgent care or go to the hospital?
So that's a great question because there's really 3 or 4 different kinds of visits that we have, right? So there are the visits that are your preventative maintenance, your annual physical, pap smear, get your cholesterol checked. Those are typically best done with your primary care provider that in person that you know, they're pretty comprehensive. Then there are the chronic care visits, which is I have high blood pressure, I need to go get it checked. And increasingly we're starting to use some of those applications for telemedicine, particularly the BMH care type of telemedicine. But where we mainly use it right now are for the acute episodic things. So these are not, and there's 2 kinds. There's the life-threatening things. I think I'm having a heart attack or stroke. Those you go to the ER. 911 go to the ER.
Period. Okay, good.
But you might be making dinner and I cut my finger. Does this need stitches? Does this need antibiotics? Or I have a sore throat. I think I'm coming down with strep, or I think I'm coming down with sinusitis, or I have a urinary tract infection. So these things that pop up sort of unexpectedly but are not life-threatening, that's sort of the niche for these telemedicine visits. So acute low acuity.
So I'm going to actually type in my symptoms, but then a physician actually physically is going to talk me through it too, to ask me questions or symptoms that I may not even know. Is that how it works?
That's correct. They'll ask you more in depth about your symptoms, how long they've persisted, and things like that.
Again, what can I come armed with to make me a good patient when I do join the Beaufort Memorial Health Anywhere?
I would say as much information as possible is always helpful. Any chronic conditions, any medications that you're currently taking.
Okay, so list of my medications.
Allergies.
Okay.
Chronic
history,
conditions.
right. Past
Oh, history,
yeah.
okay.
Right. Those are the basics, and the system will walk you through that before you ever see the doc.
Yeah,
So,
it does, because I didn't have you here when I did it, and it was easy. It was really user-friendly, and I think that's probably a real good note to say, too, that it's really intuitive and user-friendly. So your design team did a beautiful job on that. Let me ask you about ages and demographic. Who do you see using this?
Well, the app is great for patients of all ages, pediatrics through geriatrics. We actually see a large population from the 35 to 50 range.
Because we're working and we don't want to take time to go to the doctor.
Yes.
Yeah.
The working professionals, the stay-at-home moms and dads, really anyone with transportation issues as well can use it.
And then as far as a fee, how does that work? Is it insurance covered? Is there a fee for service?
It's a flat rate, $59 per visit.
Oh, wow.
Yes.
Oh my gosh. Oh, this is
pretty good deal. Yeah.
Yeah, this is wonderful. Last time I talked to you about it, it was really a new, innovative opportunity for Beaufort Memorial Hospital, and you've been thrilled and pleased.
Yeah, we have not quite a year of experience. When we launched it last year, it was right at the height of flu season, so we had a big rush of patients and really open to great reviews. And our experience since then has been the same. I think patients like it, they love the convenience. The docs like it because it's, these are quick, very well-defined visits, and they can get in and
They
out.
love it.
Yeah.
Beaufort Memorial Hospital, care anywhere, and they mean it. Thank you for joining us. Thank you all for joining us here on Girl Talk. Please have a wonderful week. Bye-bye. To access BMH Care Anywhere, download the app from Google Play or the App Store, or visit bmhcareanywhere.org.